This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
A dilemma is a situation in which one needs to choose.
Paano ako gagaling?
There's an ethical issue.
Enter the
Supposed
second.
to help first or...
Medical Dilemma.
Hi, I'm Sonny del Rosario, and thank you for tuning in to Medical Dilemma. Medically speaking, there is some truth to the saying, beauty is skin deep, but ugliness goes all the way to the bones. When your skin is healthy, you probably are. When lesions appear on your skin, then there must be something wrong with you inside. To help us understand the matter of skin lesions and other skin diseases, we have a specialist in allergy and dermatologic surgery, the chair of the section of dermatology at the Medical City. She is also a consultant dermatologist at Jose R. Reyes Memorial Medical Center and the Manila Doctors Hospital, Dr. Lilian Lopez Villafuerte. Welcome to the show, Dr. Villafuerte.
Hi, Sonny. Good evening. And I'm glad to be here with you in this show, Medical Dilemmas.
Okay, Dr. Villafuerte, could you please tell us a little bit about your specialty in dermatology?
Okay. Well, I practice dermatology, which deals with diseases of the skin, hair, and nails. And we also deal with some aspects of cosmetic dermatology. So aside from treating pathological skin diseases, we also deal with cosmetic treatments to enhance skin features. So I also do, my main special interest is cutaneous allergy. So I do patch testing to detect contact dermatitis and its main causes. And I also do dermatologic surgery, particularly laser surgery.
Laser surgery.
Yes.
When you say cutaneous, which part of the body is this exactly?
The skin, we deal with the skin, hair, and nails.
So it's the surface,
Yes.
the outer part of the skin.
Yes.
Okay. What are the most common skin diseases that you encounter in your practice?
Well, right now, I brought some slides to show you some of the common skin diseases that we've seen during last year. So I've listed them down, and I brought some slides, so if you'd like to focus there. So you can see there that scabies is still number one, no?
Scabies.
It's scabies, contact dermatitis, pimples or acne vulgaris, eczema such as lichen simplex chronicus, seborrheic dermatitis, and atopic dermatitis. Warts, we see a lot of warts also, and the name for that is verruca vulgaris. And in
Verruca
children,
vulgaris.
warts can be in the form of molluscum contagiosum, no? And we also see fungal infections kagaya ng tinea corporis and also dyshydrotic eczema. So I have some pictures if you want to just flash or run through
Sure.
them.
Go ahead, Doctora.
Okay.
So can we have the slides?
So yung scabies, it's very common, lalo na for crowded environments. So you will see that when patients come in with bringing their whole family with them, lahat sila affected, nangangate. That's caused by a scabies mite. In common Filipino language, it's called scabies or kagaw. So this is how it looks like. Yan, mga butlig-butlig. And it affects the thin surface areas like the webs of the fingers, yung mga wrists, mga sides of the body, kilikili, like that. And one hallmark is nocturnal pruritus, or it's more itchy at night. Kasi you see that organism that I showed you initially, yung kagaw, they crawl at night and then they mate at night and they produce their eggs at night. Kaya sa gabi, kating-kate. And since people who sleep close by or they sleep close together, they can transfer the mites to the other person. So, nagkakawahan.
I see. So these are the same as the bed bugs, or are they different?
No, they're different.
They're different.
These are caused by scabies mites. The bed bugs naman are caused by another organism.
I see. Okay. Do you have other slides to show us?
Yes. This one naman is contact dermatitis. This is caused by materials to which a patient develops allergy to when these materials are in contact with the skin. In particular, for example, yung unang slide there, no, with the belt,
Yes.
this patient developed an allergy to the metal called nickel. And
Nickel, okay.
because it's close to the skin, dun sa peri-umbilical area niya, pag namawi siya, and then because of the contact with that allergen, he or she can develop a skin lesion. And then it
Okay.
becomes itchy, and the patient scratches it, and then it becomes worse. On the left, on the other side naman, you can see rash naman on the perioral areas can be due naman to cosmetics like lipstick. Dun sa hand naman, contacts with chemicals and detergents can also produce lesions on the hands in the form of eczemas.
Okay.
So yan, dito, slippers. If you're
Slippers.
allergic to rubber, and then you wear rubber slippers, then you can develop that particular pattern.
I see.
So, corresponding to the straps of the slippers. Ito naman, acne, very common among teenagers. So, this is the main bread and butter of dermatology, especially in the teenage group.
Okay.
So, how does it start? It starts with accumulation of dead skin and sebum. Tapos, the bacteria will penetrate through those sebaceous glands and it can cause inflammation. That's why you see acne as red papules.
Okay. And
This one naman is eczema. This is
Eczema.
due to chronic scratching. It's called lichen simplex chronicus. At its worst, kumakapal, nagiging leathery, parang leather, no? It's
Like this
because
one.
of the constant scratching of patients.
Okay.
And because of that, yan, no, ang kapal-kapal na niyan. So, sometimes it's hard for the topical medicaments to penetrate through. And one of the treatments that we do for that is intralesional injections para mas
Intralesional
mabilis
injection.
oo.
Okay.
So
And
ito naman,
this one?
among children, sometimes they develop yung yellowish, greasy, crusted scales, usually starting on the forehead. And you see that among infants up to 2 months of age. Next slide.
Okay.
Among adults, this can also persist as scaliness on the eyebrow area or on the nasolabial, dito sa malapit sa
Nose
sa
bridge.
nose. And also on the scalp as dandruff. Ito
I see.
naman, atopic dermatitis naman to, another kind of eczema, commonly seen among children. Makating-makati yung mga ano nila, no? Flexures.
Okay.
So yan, nangangati yan, namumula, and it's persistent and chronic.
I see.
Next. So this one, it can start in children from 3 months and up. Next. Ito naman, warts. See? At its worst, ang dami-dami niyan because infectious yan eh. So you really have to treat it immediately kasi it can really proliferate. See, there in the feet, tsaka there on the hands.
Okay. All right. So thank you so much for that information, Dr. Villafuerte. At this point, we'll have to take a break just for a few reminders from our sponsors.
comes out of my mouth, especially in such a place where anything can spread like wildfire.
When you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?